The thing I miss most in the summer is baseball.
There are a number of health professionals who can't wait for sports to come back.
I have not missed a Dolphins game in 25 years.
But in the showdown between emotion and public health and safety, they know which side they need to support.
I also have to think about my role as an epidemiologist and a public health person, and are we adding too much risk by bringing any sport back?
So they're keeping their eyes on how certain sports plan to resume play, and those plans vary.
It's about whether or not it's inside or outside, how many people are involved, and the level of contact between players.
Which is why some sports have been able to resume their schedule already. Right now, NASCAR and the PGA are both proceeding with weekly events in different cities. These organizations are taking precautions, which include strict social distancing measures.
The overarching goal here is not just to protect the people involved in the league, but also make sure that you're not a threat to public health more broadly.
For other leagues, it'll require a transformation. The NBA, NHL, MLS, and the National Women's Soccer League plan to isolate their teams in 1 or 2 cities. They'll all play in a tournament or start postseason competition.
The devil is going to be in the details.
Dr. Bruce Farber is the chief of infectious diseases at Northwell Health in New York. He's an informal medical consultant to the NHL, but he is not designing the league's plan to return. Right now, the NHL is slated to start the Stanley Cup playoffs in 2 hub cities with limits on who can be around the team and where they can eat, sleep, and play.
In general, I think everyone's taking this seriously. I think everyone knows we're in a whole different era than we were 6 months ago. And although the policies and procedures and ideas may be correct, the execution has to be really very careful and methodical.
Farber warns many of these plans haven't been finalized because there are so many variables. He adds frequent testing will be critical, but that has its own issues.
If you tested everybody right in the beginning of the practice, right in the beginning of the play, and you had that result immediately, you could really limit how many people are going to be exposed and have to go out of play. And the question is that going to be available? And the answer is it's not clear.
And then there's the inevitable scenario, when someone tests positive.
I think that setting something as specific as one person means that the league or the team shuts down is overly restrictive. Every league and every team needs to be prepared to shut down at any time. But where the leagues really have the ability to do well at this is by keeping very accurate lists of everybody that this person has been in contact with. And then it is classic gumshoe epidemiology to then go through, isolate all those people that are on the contact lists and test them all.
This is all operating under the assumption there are no fans at the events, but both the PGA and LPGA may allow fans at events next month. Health experts say that could work given the fact golf is outside and there is a lot of space. However, NASCAR's plan to have limited attendance is a concern for Dr. Binney.
If we put 5,000 people into Talladega and we don't see an explosive outbreak from that, that's perfectly possible and even normal, okay? Because this disease has what we would call a lot of stochasticity to it, which is just a fancy word for randomness. We need to understand that holding one race with fans is not evidence that continuing to hold races with fans is safe.
Both Dr. Binney and Dr. Snowinbus-Newman say they hope other leagues such as Major League Baseball and the National Football League can get a season in, but they say it's too soon to tell. For Newsy, I'm Austin Kim in Chicago.